Ontario lifts capacity limits at restaurants, gyms, and cinemas. Proof of vaccination will soon be gone too. As restrictions are scaled back, what will it mean for those who are immunocompromised? Like JOCELYN, who is vaccinated and currently in remission after she was diagnosed with an incurable form of cancer.
The decisions that are being made for the perfectly healthy. And there are so many of us who are slightly immunocompromised, slightly concerned.
Some say vaccine passports have given them a sense of comfort, including Mackenzie, who has a heart condition and got surgery during the pandemic.
I still will not be going into restaurants at all, just because I don't feel comfortable doing that, especially with vaccine passports going to be lifted. I don't know who's going to be vaccinated, who's not.
Joanna's 16-year-old daughter has been a patient at Sick Kids Hospital all her life, a heart transplant recipient, and is on medication that suppresses her immune system.
I do understand that people are really frustrated and they want to get back to normal, and our family does too. When other people are able to start opening up and doing more things, we're going further into hiding because we don't have that safety net.
But opinions are diverse. Jordan, who is immunocompromised, says 2 years of restrictions is enough and it's time to reopen.
It can be scary, but if you wear your mask, you wash your hands, you're clean, you've taken your boosters, it's time to start living again and time to be out there. We can't just hide in a box for the rest of our lives.
CityNews spoke with 2 doctors, both expressing concerns for the population who is at higher risk of more severe illness, including Dr. Lisa Richardson, who says Ontario needs to take more of a staged approach that is careful and responsive.
Obviously, I'm worried. I mean, I just came off of a good deal of time, many weeks in a row, attending on the COVID inpatient unit. And the people I was seeing were either people who were unvaccinated or they were people who were immunocompromised and had severe chronic illnesses.
The province says proof of vaccination requirements were intended to be temporary, with the Chief Medical Officer of Health stating he is optimistic that a majority of Ontarians who are eligible are vaccinated and there are treatments available. But a palliative care doctor says we need proactive measures to protect the healthcare system and prevent businesses from closing, adding that the pandemic isn't over.
We need to upgrade our vaccine certificate program, but we also need to do a much better job at acknowledging airborne transmission of COVID-19. I'm hopefully optimistic that the peak of Omicron has passed. It's definitely not certain what the impact of easing these restrictions will be. And secondly, we also have a subvariant of Omicron, BA2, which is likely more contagious and perhaps even causing more severe disease. So we've got to be cautious.
A disability advocate in Canada and around the world says while many refer to these measures as restrictions, a population that's more vulnerable to COVID-19 sees them as protections.
All people are asking for from the disabled and chronically ill and immunocompromised communities is a little bit of care, going forward, recognizing that this threat is still out there.
In Toronto, I'm Faiza Amin for City News.